While I was practicing, I noticed that there were 5 or 6 men and women practicing along with me. I realized that during the process, there was one particular movement that none of them could do correctly. Moreover, most of the coaches who were practicing with us, especially those who always complain about not being able to build bigger shoulders, your problem might be right here. Besides the compression of your posterior mediastinum, the reason your shoulders just won't grow, apart from what we discussed yesterday morning about your grip issues, could also be this. The second most important factor is the control of your head and neck. For example, when we talk about back exercises, don't we teach you how to coordinate your head and neck with your movements? Actually, in this movement, because when we learn any kind of training, usually when we're being taught, they tell you to keep your head and neck still, right? Usually when we perform the movement, they tell you not to move your head and neck around, right? But often you'll notice that when we do it, it's actually fine if your head moves a little. However, when you do move, the movement of your head and the muscles and joints of the area you're training need to be coordinated. Sometimes moving can actually be more effective than keeping still, but you absolutely must not move in the wrong way, because that will cause problems. So we're still talking about the posterior mediastinum, but I'm adding this point in because it's also very helpful for pushing back and for the posterior mediastinum as well. Yes, it improves yours. Straightening the thoracic and lumbar curves, straightening the chest curve, this is extremely helpful for improving the physiological curvature of your spine, and it's also very beneficial for your muscle training. If you can't do this well, then in all your shoulder exercises, you basically won't be able to effectively target your shoulders. In other words, it will be very hard for you to build bigger shoulders. And this has nothing to do with how much weight you're pushing or how heavy your lateral raises are. The problem lies in the way you perform the movement, because you're not controlling your head and neck properly while holding the weight. You won't be able to effectively target your intended muscles, no matter how you train, and it's especially easy to end up with shoulder impingement or that popping sound in your shoulder joints. Most women want to make certain areas look better, improving the shoulder lines, tightening up the soft flesh, getting a better back contour, lifting the glutes, and revealing some abs, because they know the chest can't really be made bigger through training. Generally, the goal is to improve these areas. Whether it's women's body sculpting, yoga, or Pilates, they tend to do a lot of lateral raise exercises. These movements are all very effective. However, you need to control your movements well. If you don't, it's easy to compress your posterior mediastinum, which can lead to that popping sound in your shoulders during training. First, let me say that flexing your cervical and thoracic spine together with your lumbar spine is not an incorrect movement. In many cases, you need to observe whether it's your cervical, thoracic, and lumbar spine flexing together. Whether they move together or separately depends on what movement you are doing and what your purpose is. As I said on the first day, there's no absolute right or wrong in the movement itself. It depends on what you want to achieve. For example, if I ask you to bend over and touch the ground, you definitely can't do it with your head tilted back, right? If you tilt your head back, your lumbar spine extends. But to bend over and touch the ground, your lumbar spine needs to flex, correct? So if your lumbar spine extends along with the movement, then when you bend forward to touch the ground, you end up hinging more at the hips. That would be an incorrect movement. A lot of people bend over to touch the ground like this. Have you seen this before? Many people bend over to touch the ground this way, but this is an incorrect movement. When bending over to touch the ground, I need to involve the cervical, thoracic, and lumbar spine. All three need to move. It's not that they move all at once, but rather gradually from top to bottom, yet all three must participate. This is how you bend over to touch the ground. If you bend over and still tilt your head back, that's incorrect. So during the process of bending over to touch the ground, all three parts need to be flexed. Only like this can I actually bend over and touch the ground. There's no problem with that. When I come back up, all three need to go from flexion to extension. So at this point, all three are extended, and that's fine. But if you're training your back, for example, when doing a lat pull down with a wide grip, you're working your upper and middle back. At this point, as you stretch during the movement, doesn't it make it easier for the muscles in your thoracic spine and back to lengthen? So in this situation, you need to find a way to flex your thoracic spine more to stretch the muscles, but at the same time, you can't overuse your lumbar spine, because if you excessively pull your lumbar spine downward, it turns into lumbar extension to initiate the movement, and then you're just training your erector spinae. So at this point, you need to precisely control your thoracic spine, making your lumbar spine stable and your thoracic spine flexible. If you can do this, then you can really work on the finer details of your muscles and fully stimulate the areas you want to train. So when we're doing different movements, the way we control our head and neck is different. What you often see is a lot of bodybuilders. When they're doing the bench press, as they lower the bar, their head comes up, and as they push up, their head goes down. Have you seen this? Have you seen this kind of thing? So when they're lying down and lowering the bar, their head comes up. Do you know why they do this? As they lower the bar, their head moves forward and lifts up, and when they push the bar up, their head goes down. Do you know why they do this? It's not about thoracic spine movement. They're holding such heavy weights. How much can their thoracic spine really move? When you lower the bar, your head moves forward. This allows your chest to stretch more fully, and then when you push up or lower the bar, it helps make your support more stable. So, many people are used to using this kind of technique. This is how they do the bench press. Unlike the bench press where you have support, back exercises like seated rows leave you unsupported. A group post about this highlighted how confusing this can be, especially for women new to training. They think that by lowering their head, pushing their thoracic spine out, and sending their lumbar spine forward like this, that's the right way. You can think of it as a curve in the neck and a curve in the lower back. So, what does it mean if the lumbar curve is greater than the thoracic curve? It means that when you lower your head and push forward like this, the curve in your lumbar spine will end up being greater than the curve in your thoracic spine. Do you know what the main function of your thoracic spine is? The main function of the thoracic spine is rotation, while the main function of the lumbar spine is flexion and extension. So, when you bend backward, it's mostly your lower back that's moving, which is why you've never heard anyone say they're working on their lower thoracic spine. People usually say they're training their lower back, not their lower thoracic spine. So the lumbar spine is more suited for flexion and extension. The thoracic spine is more suited for rotation, so when you're doing seated rows, if you lower your head and move together, your cervical spine, thoracic spine, and lumbar spine all move. The movement in your lumbar spine will definitely be greater than that in your thoracic spine, because your lumbar spine is naturally better at flexion and extension. At this point, your erector spinae will be stretched more than your latissimus dorsi and more than your rhomboids and middle and lower trapezius. So when you initiate the movement, your erector spinae will definitely be more engaged. Then you won't be able to train your back very well. And since you're bending forward so much, there's also a force in front of you. This force is quite significant, and it's almost a horizontal shearing force. You know, the force that intervertebral discs fear the most is shearing force. So if you lower your head, hunch your shoulders, and bend forward, and you use heavy weights, just doing a few reps in a short period of time could easily give you a herniated disc. This movement actually becomes a high-risk exercise. You might think that this way gives you a better stretch, but that's not the case. When you do this, your lumbar flexion is greater than your thoracic flexion. And at this point, not only are you overstretching the muscles in the back, but also the joint capsules and the ligaments behind your lumbar spine are being excessively stretched. The disc is subjected to a shearing force when you keep moving like this, and you end up with overall flexion and overall extension. This kind of movement is meant for bending over to touch the ground, not for seated rows, but this is exactly how many women love to do it. There are also some men who train for bodybuilding in the gym who do it this way too. Why is that? Many of my students who compete in bodybuilding have come to me, but they suffer from serious disc herniation. When they do seated rows, they also tuck their chins and bend their whole bodies like this because they imagine that they need to open up their entire back like a pot lid, stretching it all at once. Your intention isn't wrong, but the way you're doing it is. To use heavy weights and maximize your muscle development, I tell you to lift your chin during the seated rows. This extends your cervical and lumbar spine while keeping your side bones firmly seated on the bench. In this specific position, what bends more is it's the thoracic spine, because your lumbar spine is being restricted. When your lumbar spine is restricted and you reach forward, what bends more is the thoracic spine. Only then can you fully stretch the muscles of your mid and upper back. Only then can you open up the inner sides of your shoulder blades, and only then can you fill in that hollow area. So this is the position of the head and neck, and its importance for training your back. But when it comes to the shoulders, things change again. Why do they change? Because when I pull my back, the adduction and abduction of my shoulder blades, or the protraction and retraction, at this point only involve the middle and lower trapezius muscles. If you pull at this horizontal level, only the middle trapezius is involved. If you do a high pull down, then both the middle and lower trapezius are involved, but not the upper trapezius. Why is that? Because the upper trapezius is responsible for elevation and upward rotation. It is not mainly responsible for protraction and retraction. However, during the recommendation process, what gets involved more is actually the upper trapezius. So during the recommendation process, whether I push like this, which trains the anterior deltoid, or like this, which trains the middle deltoid, at this point, your scapula must perform upward rotation. If you want to direct the force onto your shoulders, you need to prevent the upper trapezius from activating too early. When I'm training my back, I want to avoid excessive involvement of the erector spinae. When I'm training shoulders, I want to avoid excessive involvement of the upper trapezius. The control of both of these muscles is entirely in the head and neck. They're not your target muscles, and you can't control your target muscles. So this morning, the students who followed me for recommendations, regardless of how long they've been training, none of them had learned this before, and what they were doing was all wrong.